Hello, my name is Patrick McCautlong and I'm an occupational therapist. What is an occupational therapist? An occupational therapist helps with your everyday life activities, which is what we call occupations, to promote health, well-being, and your ability to participate from simple occupations such as toileting to important activities that are meaningful in your life as independently as possible. So today we're going to be talking about rheumatoid arthritis. Today, we're going to go over the following slides, starting with what is rheumatoid arthritis, the complications it can come with, prevalence and etiology, prognosis, how can OT help with RA, such as joint protection and task modification, assistive devices, and using cognitive behavioral therapy. So what is rheumatoid arthritis? RA is a long-lasting condition that can make your joints swell, hurt, and become damaged. Over time, it can even change the shape of your joints and wear down your bones. This condition doesn't just affect your joints, it can also cause problems in other parts of your body, like your heart, lungs, nerves, and eyes. The causes of RA is unknown, but what we know is that RA can make it hard to do everyday activities and can lower your overall quality of life. This can lead to not being able to do what you would like or need to do on a daily basis. RA complications. So what can RA lead to? RA can lead to several complications. It can cause bone erosion and joint deformity, especially in the hand joints and both sides of the body at the same time. Some complications of RA include carpal tunnel syndrome, um, which can occur when the inflammation compresses the nerve in the wrist, leading to numbness and tingling in the hand and fingers. Another complication is a boutonniere deformity, where the fingers or thumbs are bent in a way that makes it difficult to straighten them and use the fingertips. RA can also lead to osteoporosis, weakening the bones and making them more prone to fractures. These are just a few things that can happen as a result of having RA. Prevalence and etiology. According to statistics, 80% of patients that have onset of RA occurs between 35 to 50 years old. However, the other 20% range from early age and retirement age, which can cause significant pain and disability to these populations. Women, smokers, individuals exposed to air pollution, having family history, and obesity are at a higher risk of getting RA. Prognosis. Hand deformities, joint inflammation, and total pain can have a major impact on hand function, making it difficult to perform daily activities. They can also lead to distress or depression. It is essential to start treating RA as soon as possible to reduce the inflammation and prevent the symptoms it can produce. So how can occupational therapy help with RA? As occupational therapists, we use interventions that uses everyday life activities to promote health, well-being, and ability to participate in the essential activities in our lives. Our primary goal is to enable patients to improve performance and participation in daily life roles and routines despite functional impairments due to rheumatoid arthritis. Some of the treatments that we do that would help clients with RA are joint protection and task modification, assistive devices, and cognitive behavioral therapy. Joint protection and task modification. For range of motion, we will educate you on the importance of always moving your joints and muscles as it improves flexibility and reduce stiffness, swelling, and pain, which would be great for RA. We will also educate and present how you can incorporate physical activity with your daily routines. According to a study, home exercise programs were effective in improving strength, mobility, and self-efficacy and reducing stiffness and pain. Splints. Splints can help with RA by reducing pain, swelling, and the risk of deformity. They can also help improve function and stability and damaged or painful joints. Finally, we would teach you learning techniques, um, doing things that won't further damage your affected joints. For example, if someone has joint pain on their fingers caused by RA, we would instruct you to open a bottle or a jar with your palm and not your fingers, as we want you to put less strain on the joints, and we would want you to use the strongest, largest joint available. Assistive devices. The field of occupational therapy offers a wide variety of tools and devices that can greatly improve the lives of people with physical challenges. For example, for people with RA and hand deformities, there are special tools and utensils that can make daily tasks easier. These tools are designed to help improve grip, hand alignment, and reduce stress on the joints. By using these tools, people with RA can maintain their independence and continue to engage in daily activities. Starting with adaptive utensils. Adaptive utensils with texturized handles may help with easy gripping, such as the one in the picture. Utensils lightweight enough for you to hold them without using a lot of exertion could help you experience less pain and inflammation. Also, wider handles might help support reduced hand grip strength. For foam grips, such as the one in the picture over here, foam tubing grips are designed to help make it easier to hold personal care items and improve overall dexterity during use. Possible uses include your toothbrush, comb, writing utensils, and more. Sock aids. Sock aids is this one in the picture, which is pulling on your socks or compression stockings, might be challenging with RA. Consider the sock aid with foam handles designed to help make the process less painful, especially with um, the inflammation on the joints on your fingers. Cognitive behavioral therapy and mindfulness. So CBT and mindfulness aims to influence coping behavior at a deeper level by reorganizing the uh, cognitive process related to one's disease experience. Um, 4 studies found that CBT had a small but significant effect on pain, function, and psychological well-being overall when it comes to our clients with rheumatoid arthritis. In one study that compared CBT and mindfulness, the CBT group had demonstrated better cognitive control of disease symptoms and pain control of RA, while the mindfulness group showed greater awareness of coping and emotions, uh, as well as improved physician-rated joint tenderness. Finally, one of the great aspects of occupational therapy is that it always involves the client support system, which includes their family and friends. A study comparing a participant and spouse intervention with a participant only intervention revealed improved function and psychological well-being in both groups. However, communication with the participant and spouse significantly improved at the 6-month follow-up. So in conclusion, we focus on preventing physical problem from getting worse, which is that joint protection and task modification. We help patients understand and cope with their condition. which is the cognitive behavioral therapy slash mindfulness. And we find ways to help patients do the things that are important to them, um, like assistive devices, with taking care of themselves, working, going to school, being social, and enjoying free time. Our goal is to promote independence and self-sufficiency in all areas of life. That concludes my PowerPoint. Thank you.